Hello everyone. It's a great pleasure to wish you welcome to this webinar about promoting the progress on Barnahus in Europe. We are several presenters in this webinar. It's Shona van Blixen, Olivia Lynn Haldorsen, Rebecca O'Donnell, and myself, Turid Heiberg, who has, all of us have been part of the Promise management team. In the audience, we are so fortunate that more than 40 participants said they would join the webinar. As of now, we have 21 attendees and probably more are coming along. We have participants from nearly all countries in Europe, including Albania, Armenia, Moldova, Slovakia, Turkey, and so on. So we are very well represented from you, the audience. In the audience, we have a lot of participants from the NGOs, but not the least also from ministries, from the justice, judicial, the local governments, national agencies, police, therapists, daycare, and so on. So very good represented both from the child protection side and from the judicial side, and the NGOs, which are very important in carrying out our work. The webinar today covers a whole range of issues and topics. It will give background to the Promise project, which have been carried on from 2015 to up till today. And it will go into details about the final conference, the establishment of the European Barnahus movement, how you can do advocacy, the vision of Promise, and also we will introduce the Promise 2, which will run from 2017 until 2019. We have a system now of polls, and we will test what you think about how we do things, how we should do things, and so on. And Shona van Blixen, she will present this first poll to you.
Mm-hmm. Welcome to the first poll. The question is, if you are familiar with the Barnahus or Children's House model. It's quite a straightforward question, as you can see. Please click yes, no, or other. With all of the polls today, we would appreciate if you have an other, or if you have comments, questions, something to add, please do use the questions feature in the webinar system. So far, 75, 80%, 85% have voted. Last few seconds here. All right. Just about 100%. And the results. So many people are, in fact, familiar with the Barnahus model. There's still a couple of people who said no, or perhaps unsure. So with that, I give the floor back to Turid.
Thank you, Shona. Here, yes, sorry, that was a little bit, that was good. So many are familiar with the Barnahus model and or the Children's House model. And as you all know, here you have a very good visual about the different components of the Barnahus. And in fact, Barnahus, or the Children's House model, is a child-friendly office where children come and they are assessed by many experts. They only have to give evidence or come once or maybe twice or something like that in order to take part in a forensic interview and medical investigations. The whole thing about the Barnahus is to reduce and avoid re-traumatization because of putting the needs of the child at the center. It's the possibility for the child to disclose their story, what they have witnessed, what they have been victims of, and they are not, in most cases, not expected to take part in the court proceeding as such. It's enough with the video from the when the child is giving his or her witness statement. And you have so many then professions, disciplines and agencies gathered under one roof, including the medical examination, mental health examination and treatment, and responses to each child. And one thing about the European Barnahus model is that it is mostly integrated into the national social welfare, health and justice systems in most countries. So please take a look once again on this model. What did the Promise project achieve during 2015 and 2017? A relatively short time span. It was, but a lot had happened before this project. It was the children's advocacy centers in the US that had inspired Iceland as the first Barnahus in Europe to develop this model. And they did it as an integral part of the child welfare and justice system. They also encouraged all other development of Barnahus, and those pioneers in the Icelandic Barnahus and other Barnahus in Sweden, Norway, Denmark have continued to inspire and support other Barnahus development in rest of Europe. The Promise project had more than 11 countries and cities and participants from there as a pilot study and pilot initiative. The project offered study visits, networking, capacity building, and gained a lot of interest because for now professionals could come to, and officials could come together, inspire each other, and get support how to go to the next step. The project has also generated a lot of interest in Europe and globally, and developed standards and other relevant background material. As we can see from this statement, how it previously was, or how it is still in many cases when the child is without the proper multidisciplinary and interagency support and cooperation, how they will have to stand up in court. While with the Children's House model, we are minimizing all this negativity that previously or currently still happens to the child. I would now like to hand over the mic to Rebecca and Olivia to take us further into the Promise Conference in Brussels and the resources we have developed. Please, Rebecca and Olivia.
Thank you very much, Turid. This is Olivia Lind Halvarsson speaking. I would just like to take a couple of moments to speak about the meeting that we held to close Promise. Turid spoke a little bit about some of our main achievements, and I think that this conference was really nice finalization of the work that we have been doing together. So one of the things that we saw, and excuse me, I just have to make a little technical change before I can begin. There we go. So one of the key achievements that we felt that was that we really enjoyed and strengthened the support from the Commission. We had throughout the project a lot of feedback that was positive and supportive from the Commission, and in many cases they spoke about our project as a flagship project. And this was really reinforced. We had the attendance of the Commissioner for Justice, Vera Jourova, who spoke well and supported the project. And we also had Commission officials such as the coordinator on the rights of the child, Margaret Tude. I think also if we continue to look at the regional organizations in Europe, we felt that we really generated further interest from the Council of Europe. Another thing that happened was that we managed to reinforce the connections that we have made with international actors at different levels. We had attendees from the Ministry of Justice of Morocco, who together with many other countries outside the EU are interested in the Barnahus model. But we also connected with Susan Bissell, the director of the Global Partnership to End Violence Against Children, and Marta Santos Paez was at the meeting and spoke supportively of the project. Throughout the project, we also had connections with the US and our expert there, Resmi Oral, who could really connect us to the origins of the Barnahus model and how it has developed in recent years. We also broadened the scope of our participants in the Barnahus movement by having attendance of EU countries and experts that hadn't yet participated in Promise meetings, much as in the same way that many of you now are connecting to us, which we find crucial and important to the continuation of our work and of course promoting the Barnahus model throughout Europe. We also had lots of inspirational talks, and we learned a lot from new actors that we hadn't engaged with throughout the project. For instance, we had judges from many different countries. We had one judge that has been crucial to the process in Iceland, and we had the ENOC chair. And we were also very pleased to see that people attended our live streaming. The meeting in Brussels was also an opportunity for us to launch our Promise resources. And these are all very practical tools which address specific aspects of the Barnahus in terms of how it has been established, the process leading to the establishment, and how you can advocate for Barnahus. So there's benchmarking, there's an overview, law and guidance, quality standards, experiences in making progress and planning for progress. And we feel that these can be used individually, but also in a complementary way for both operational and practical matters, as well as supporting your advocacy. And we also feel that they can be useful for a wide range of different professionals. Many of you who are represented here today might find them very useful in your work. And they will obviously be central to the work in Promise 2, which Turid will speak about at the end of our webinar today. So I really encourage you to take a look at these. You have the link here on the screen. And perhaps begin by going to page 9 in the blue document there called Promoting Progress on Barnahus in Europe, where you have an overview of the contents and focus of all of these resources. So I will now hand over to Shauna, who will talk a little bit about where we are now in Europe.
Thank you very much, Olivia, for handing the presentation over to me. Just a moment. I think I can take the controls. So when we launched the project, a key aspect of the project was bringing in a number of pilot countries. And it was a bit of a recruitment process, bringing pilot countries in, finding the right representatives, and really getting the representatives on board to attend the exchanges of the project and to give their input to the publications that Olivia just presented. And we really prioritized bringing on the organizations that have made some progress in raising awareness in their countries, in starting up the processes needed to establish a Barnahus or similar model in their own countries. And in many of the countries that ended up joining us, they have been working on this for many years. So it was really encouraging to us to see that since launching the project, so many of the pilot countries have made incredible progress. We have 6 pilot countries that have, at the last time that we surveyed them, have launched a Barnahus or comparable model. First with Lithuania, then Hungary, Estonia, Latvia. We were told was planning for June, so we believe that has happened. Same with Malta in July, and Cyprus this month. We believe that they were supposed to launch. And we have 2 pilot countries that have preliminary dates in Ireland and in Poland, January, so around the end of the year, the beginning of next year. And then we have a number of countries who are continuing to make quite great progress. They just don't have any dates that they can share with us right now. Bulgaria, England, Germany, Romania, Scotland, and there are other countries that have been involved as well. Finland comes to mind. But looking at this slide, perhaps you know some information that I don't know yet, or you're a country that's not on this slide. So we have another poll for you. Where are you now? And let me launch this poll. So if you are an MDIA service or you are helping to launch one, please let us know if you have a one-stop shop with all of the relevant agencies and formal agreements, or maybe you're missing formal agreements, or maybe you have some relevant agencies. Maybe there's national coordination in place, but not under one roof, or maybe there's another situation. So again, a reminder: please use the other function to. If you use the other function, please send a comment or a question, letting us know what's missing from this slide for you. So far, 24% have voted, so we'll give it another minute for everyone to have some time. Just over 50% have voted now, and many people say other. That's very curious. Please do let us know in the comments or questions if you can summarize. 68% have voted. Just last few seconds here until I close the poll. All right, there we are. So 29% of people who responded said that they have a one-stop shop, all relevant agencies and formal agreements in place. 19% said MDIA one-stop shop with some relevant agencies. 1 reported national coordination, and quite many said other. I still don't have any comments, but perhaps if you continue commenting on this, then I can summarize it at the end if we have the time. So with that, I will close the poll, and I will pass this over to Rebecca.
Good morning, everybody. So we have seen that progress is happening and needs to keep happening around Europe. So we wanted to talk a little bit about a key component which is vital to making progress, which is advocacy. And at its core, advocacy is about influencing others to share your vision. And I'm just again taking a moment to move us on with the slides, because we had a slide which has a number of the words that come into our mind when we think about advocacy. But despite having checked this ahead of time, it is not actually functioning for me. I'm going to ask maybe Olivia to see, can she move the slides along? Apologies for this. I'll keep going and just concentrate on what we wanted to share with you. So at its core, advocacy is about influencing others to share your vision. Thanks, Olivia. It takes many different forms. It has different targets. It may look for changes in policies, procedures, practices, or structures. It has a lot of different inputs. It may rely on knowledge of practices or problems, evidence of successes. You may need to think about legal obligations as the input and the driver for your advocacy. Of course, all national contexts have their own specific opportunities and challenges, and they'll need different actions to stimulate progress. I'm aware that on the call, some participants will be intensely focused on advocacy as part of their work in an organization. But many involved in the field are practitioners who are working on cases and find that advocating for change is a natural ancillary to their work, but advocacy isn't something they tend to do on the day-to-day basis. But for everybody, developing a strategic and practical plan which defines actions and helps you implement them in a way that's really relevant to your context and audience, but also takes account of your role and your resources, is vital. And that's really what we wanted to do in the Promise project. We gathered in the experience of the partners and the experts and sat with them and tried to work together on how they'd been able to make progress. And this was all distilled into resources for you in the Promise project that Olivia's already talked about. And for advocacy in particular, we have a document called Enabling Child-Sensitive Justice that really analysed the factors and the dynamics that created change across the countries. And it tells stories and gives examples of what worked and what didn't. We also have the Advocacy Guide, which sets out 5 practical steps, these 5 practical steps for you to take action. So we really encourage you to spend time with these documents. And in terms of the steps, they are pretty straightforward. The starting point is always knowing where you are and what change you need to achieve. Knowing your opportunities and obstacles for taking action. Identifying what kind of actions need to happen, and creating an engagement strategy so you're working towards the right targets and with the right people. And then really thinking about what is going to be effective in terms of messages. So we're just in this call, we're going to spend a few minutes looking through each of these steps. But again, you will have time and I hope the opportunity to look through the documents that that are available. So in taking stock, the first step, know where you are, know where you need to go. Now, what we saw in Promise was that most partners and experts typically went through a multi-step process over some years, incremental developments. That was true in most countries. More recently, for example, in Denmark, we saw a different approach where there was a political decision which resulted in a law establishing the Barnahus. So a lot happened at the same time. But the tendency has been for things to move forward step by step. So again, in Promise, we look to identify, in broad terms, the different stages you might be at in bringing about change. One of the issues is there a low level of awareness of the prevalence of violence and its impact in your country? There's a tendency that we've seen in research for people to think that violence to children is happening elsewhere, whether that's in another country or in the past. We also may see, even if there's a recognition that violence occurs, there's a low level of understanding of what solutions, what's the best response. So we've seen people in countries go through the phases of first needing to raise awareness about violence against children, and then secondly, raise awareness, or as we've called it, champion the vision, raise awareness of what needs to happen to respond to children. And we're going to come back to how people have done this. But you may, as we've seen from the poll, already have recognition and support to put in place a response. You may be working towards the establishment of a Barnahus. And then your audience might change. You'll be less public-facing, generating a much more specific consensus amongst the professionals and agencies you work with, so that you can establish a Barnahus with all of the features that will make it effective. And then finally, you may have Barnahus up and running, but we've seen that there's always further steps in achieving excellence in practice, and some countries are focusing on that and are pioneers at that stage. So we just have a poll here inviting you to think a little bit about what your challenges are in terms of where you are and taking stock. Again, it may be a question of there being an absence of a political commitment or priority on this issue. It could be that there are agencies, that some agencies are committed to a multidisciplinary approach, others aren't. It may be simply lack of training or low interest or support more broadly in society for having a child rights or child participatory approach or other. And again, as Shauna said, it would be great to get your comments. Shauna, you're able to see whether we're getting responses. Maybe you could comment on them.
Yes, so far we have 35% voted, so we wait another couple of seconds for people to respond. I know that I got a message that one team is watching as a group in the same room, so maybe some people are also discussing with their colleagues what their answer should be.
Yep.
74%. So last few minutes, or last few seconds rather.
And we understand, of course, funding is a big challenge.
Maybe that's why 30% have said other, but here we go. So yeah. Here we see many people said other, perhaps that's the funding. But the other big one was commitment from relevant agencies. Also, political willingness, lack of training, and low interest were pretty equal with each other, really. Back to you, Rebecca.
Okay, thanks. And that brings us to the next stage in the practical steps, knowing your opportunities and obstacles. There are, once you know what you are, what outcomes are important and what you're targeting, it's very important to get a sense of your opportunities and obstacles. There are many different triggers that might offer a moment to make a case for change. And again, the guide suggests you think carefully at what level or where an opportunity might arise. It could happen at a local level rather than a national level. And it may be important to seize the opportunity to begin to make progress that can be subsequently scaled up. Or it could happen at European level, where experience in one country might be translated into another. It can be that a specific case might ignite interest. We at a European level, we saw that the 1 in 5 campaign in Cyprus generated a lot of interest. Another example was the establishment of hotlines for children in Croatia led to a lot of reporting on violence and really demonstrated the need for a specialized response. So that was very helpful in generating understandings. On obstacles, there may well be obstacles that are obvious. There may be a lack of training, as we saw, and therefore a limited understanding about children's role and needs. I was interested to see this month that there was a report in Ireland which was an expert review of the law enforcement child protection training, and it came to the conclusion that the training at the moment is inadequate, and that there should be much more interagency cooperation and co-location of services. And of course that's a nice opportunity to help make the case for the creation of a Barnahus. And it contrasts a little bit with what we found in Promise when we heard about the Norwegian situation, because as early as the early 2000s in Norway, the police had taken the initiative to strengthen investigations in the area, and a police training program really raised awareness and sensitized the police professionals of the need for more effective responses. And this really was a first step in the police taking institutional leadership for Barnahus in Norway. So it's always very interesting to see that. Obstacles, of course, may also come from unarticulated concerns, sometimes around multidisciplinary working. Professionals may not see how they can work together. Data protection can pose a difficulty, and we saw in Haarlem in the Netherlands that the creation, that obstacle was identified and tackled very vigorously to move forward. They brought together the different professional bodies to try and make progress, and ultimately came to a data protection agreement, which really kind of unlocked the way forward. So once you know your opportunities and obstacles, you then need to identify action. You will see in the guidance, again, that we have a series. We've set out questions and or specific actions you can take, and questions you can think about when considering whether these are the actions you need to take. For urging consultation on service commissioning, we've seen in some countries there was a formal commissioning process for appropriate services, and a consultative process around that might ensure it's designed in a way that allows for Barnahus to be set up. So we got into some specifics, again, really trying to capture the experience within the Promise project partners and experts. So do have a look at it. It's distilled there for you. Then you would go on, having identified what you need to do, what kind of activity could really help make the change. Create an engagement strategy is the next step. On the next slide, we have just set out a number of the actors that are involved and that you might need to think about. You need to think about who are your targets, who are your allies. In some countries, really, people start by mapping the different actors and the role they play. Think national, think international. Sometimes several actors come together. In Sweden, we can see that there were different actors played different roles. NGOs, Save the Children in that country, really ran a campaign based on a multi-country report which showed the Icelandic experience of Barnahus as a best practice. The academics in Sweden came together to report and put together research that was very important in moving things forward. The Queen in Sweden became a leading figure and supporter in the Barnahus movement. In the UK, we've seen so far that the Children's Commissioner has become very involved and very supportive, visiting the Barnahus in Iceland. We see the work of day-to-day work of paediatricians has been important there as well in really kind of distilling the experience. We have Croatia experience where careful work with the media has been very important. I could continue, but again, a lot of this is captured in the enabling child-friendly justice. The final step, once you've kind of thought about who you work with, is to deliver effective advocacy. I think most people on the call will fully understand that these are complex issues and it's not always easy to reduce them into clear and simple messages. And again, the guidance has a number of questions to help you think about this. And again, it's there really as a tool for you to use so that you don't have to reinvent the wheel, so that you can benefit from what others have gone through before. What kind of messages do you need? What kind of contribution is important? What kind of voices do you need to hear? We've seen examples of consultations with children and how that was brought forward to ministers. So again, a lot of food for thought. I'm going to leave it there. Thank you.
Thank you very much, Rebecca. Related to what Rebecca has said and supporting advocacy, the Promise Project developed some recommendations and call for actions. And they actually target and address some of the concerns or obstacles that you may experience, such as generating commitment from relevant agencies, urging more political willingness and commitment, asking for training, or even making sure that there is greater awareness in society and among children to generate more support and interest for the Barnahus model and children's right to be protected from violence more specifically. So the recommendations are really meant to support your action to promote progress on Barnahus, and they are formulated in a way that could fit all the contexts, and they can be adjusted to become more specific or more general and more targeted depending on where you are and what obstacles you see in your country. The recommendations are linked to the Promise vision. And we will look at this now and focus on the elements that we, throughout the Promise project, have seen enable the establishment and the operation of Barnahus or similar multidisciplinary and interagency services. And in using the recommendations and calls, or even developing them to fit your specific context, I encourage you to use the resources that I talked about a bit earlier. They can be used as resources, but they can of course also become advocacy objectives in themselves, for instance the standards or promoting the Barnahus model. If we look at the screen here, you will see 4 elements that we see as the foundation for realizing children's rights to protection, to participation, and access to a comprehensive response to address violence. And these 4 elements consist of the Promise vision. The first part of the vision focuses on children's right to participation, and in this context, particularly the right to be heard and to receive information. And this may entail, depending on where you are, informing societies, including children, about children's rights, about the right to participate and to be protected from violence. And more specifically for child victims and witnesses of violence, it may involve raising awareness about how children experience a process from report to trial, and then advocate for measures that prevent children from being re-traumatized throughout this process. Promoting multidisciplinary and interagency collaboration is obviously at the very core of our vision. And this again might look very different depending on where you are in your country, which we saw in the first or second poll. So this may involve, for instance, raising awareness about the benefits of working together to generate more commitment from relevant agencies to work together. But it can also involve advocating for resources where there are no resources for collaboration. And in some countries, it may also involve advocating for policy and law that enables collaboration, such as, for example, exchanging information between the different agencies, as Rebecca talked about earlier. Comprehensive and accessible services is crucial, of course, to the well-being and recovery of victims and witnesses of violence. And here you may be in a position where you still need to generate support for policy, law reform, or resources. In many contexts, it also involves promoting measures that ensure non-discrimination so that all children have access to services. And finally, throughout the Promise project, we have been reminded about how important it is that staff are qualified and specialized. So this fourth element of our vision can, for example, involve calling on government and agencies to make training mandatory and adequately resourced. And it may also involve promoting national standards and quality control. If we look a little bit more specifically at the first elements, I have on this screen put some of the calls that are particularly relevant to ensuring this part of the vision. And this is really a fundamental aspect to the process of establishing and operating Barnahus. And throughout the Promise projects, the countries involved have told us how they have grasped different opportunities. Rebecca mentioned a few, to engage in awareness raising, campaigns, media coverage, national debates, to inform public and decision makers about children's right to be protected from violence, about the impact of violence, and how children actually can become re-traumatized in the investigative and judicial process. And as you can see here, several of our calls and recommendations focus on awareness raising. We call on governments to allocate resources and civil society to promote and support awareness raising campaigns. Media plays an important role, so you can see that we've also included calls for the media. And where there is a higher level of awareness, it may be possible to move slightly from awareness raising and advocating for policy, procedures, and law reform, which enables children to exercise their right to be heard without risking re-traumatization. And this may, in some cases, even include advocating for a one-stop shop service such as Barnahus. If we move on to the next element, we have seen that in recent years there has been an increasing recognition that multidisciplinary and interagency collaboration is crucial for child-friendly and effective investigation, judicial processes, and services to child victims and witnesses of violence. And many of the countries that we worked with throughout the Promise project told us how they had worked together to promote multidisciplinary and interagency collaboration, and that they had used the Barnahus or similar models as evidence of good practice and impact. And as you can see here, there are several calls that support this element of the vision. And the key calls relate to making sure that there is policy, procedure, and law in place to not only make the collaboration mandatory, but also to enable collaboration. Many countries, as Rebecca told us earlier, have told us that data protection and confidentiality prevents them from exchanging necessary information. But there may be other obstacles that you need to be specific about in your calls. It was very interesting to see that there were so many that experienced a reluctance from relevant agents to engage in this type of collaboration. And you will see that another key call here relates to really ensuring the commitment and resources from relevant agencies to engage in collaborations and to resource services under one roof. And again, these calls and recommendations here are for inspiration and adjustment to a specific national situation. Our third element relates to comprehensive and accessible services, because as you know, a key goal of Barnahus is to ensure a full and comprehensive response for each child. This does not only involve the forensic interviews where we help the child to tell their story, to produce valid evidence for judicial proceedings while preventing re-traumatization. It also includes important elements such as medical and mental health examination and support. And the calls here focus on encouraging governments and agencies to set up, to resource and actively commit to a multidisciplinary and interagency response, which includes these services. And they also focus on supporting and engaging in awareness raising, national debates and campaigns that promote such a comprehensive response. And in some countries, I'd say in many countries, we see that there's a very specific need to make calls towards ensuring non-discrimination, so that there is a broad target group that captures all children, regardless of, for example, status, characteristics, or where they live. The final element is based on some of the feedback that we have received throughout the project. Our partners and colleagues in Promise have emphasized that training as a team is crucial. It strengthens collaboration, it increases mutual understanding, and makes the respective agencies more committed to a team effort. And individual training and supervision is, of course, not only important, of course, not only in terms of providing specialized and professional services, but also to ensure that the staff is strengthened in their role. A very specific example related to Barnahus is that there is actually evidence that shows us that children may be traumatized and even discredited as witnesses by interventions such as interviews that are not carried out, that are carried out by professionals who have not received training. So you will see here that the calls are addressed to different actors that have a role in promoting good practice and specialized skills. This can be, for example, by making political decisions about curricula, mandatory training, or resources, or by adopting organizational policies and practice. It may also involve advocating for a national collection of data and reporting on good practice. You will also see that these calls focus on promoting mandatory national quality standards and quality control. And here, the Barnahus quality standards might provide a good basis for the advocacy, or even constitute an advocacy objective in and of themselves. I would like to encourage you to take a look at these calls and use them as inspiration and adapt them to your specific national context and the biggest challenges that you see. And of course, feel very welcome to follow us in Promise 2, which really will focus on supporting in many different ways the process of advocating for progress towards the establishment and operation of Barnahus. And I will now hand over to Turid, who will speak a little bit more about just that.
Thank you, Olivia. Trying to change the slide here. Yeah. Thank you, Olivia, Rebecca, and Shona. And for the information to the audience, we will continue to be the management team in Promise 2. We are currently having negotiations with the European Commission, who is funding our activities, and with the partner countries, so that hopefully by November we can organize the kickoff meeting for Promise 2. In Promise 2, it's very much about national implementation at national level, while Promise 1 was very much about sharing information, sharing knowledge in different ways, finding the vision for the project and the European Barnahus movement, and deliberating about what is the concrete content. In phase 2 and Promise 2, we will go much more into depth at national level. That's the focus of our work. So it will also focus on the partner countries. But not only those, we also have now so many professionals in Barnahus or in similar institutions and setup that will be a support for those countries. So we will involve the existing knowledge and also organize webinars and other points of meeting and sharing knowledge where we can continue to support each other. We will also support in the way of communication and through media in different ways with countries and representatives and professionals and officials who are interested also from other countries, in particularly EU countries, but also beyond. We are already in communication with several countries beyond EU countries, but the project as such focus on EU countries. The content of Promise 2, it has two objectives, and that is to get the interagency commitment, including from the judicial sector, so we have a proper multidisciplinary and interagency cooperation. And then it is to further the knowledge and skills on the Barnahus functions. And in order to come to this commitment and heighten our skills of what it entails to drive a Barnahus, we will organize roundtables and dialogues and develop national and regional roadmaps, and most importantly, draw up formal national frameworks and agreements. We will tailor-make training for Barnahus staff, including judicial sector workshops. So there will be workshops about forensic interview, medical assessment, the judicial aspect, social aspects, and so on. While this webinar is more a summing up where we are and what we have learned so far about the content and where we will go, that we will, in Promise 2, we will organize several technical webinars on, again, the same topics of forensic interview, medical assessment, judicial ways of working, and so on. So that will be a good entry point for all those who want to support or who want to take part from their country level. One aspect we didn't really deal with that in depth. We had discussions about it, but not to the extent that we would have liked to. That part is integrated in Promise 2, and that is about the children's reflections and perspectives. In Promise 1, we discussed a lot about the best interest of the child, and the existing Barnahus at that point, they talked about how they tried to assess in timely intervals whether they themselves thought we were working to the best interest of the child. That was the starting point. Now we are going one step further, and we will develop a methodology and with the support of all those of you who already are working on the subject, see what's already have happened in that regard and how we can take it a step forward. I think this is most important for Promise 2. And then we hope to be even better in disseminating the standards and tracking tool, which is a foundation. It's our quality elements for the operating Barnahus and similar setups. We have here you can see some of the partners whom we are negotiating with, and hopefully we'll have in as the partners in Promise 2. But as I said, we are currently still in the phase of organizing it. Here you can see something more about how you can continuously be informed by subscribing to the newsletter www.tinyletter.com Promise, and where you can find the publications and more, the website we have. So it's all open for all of us and many more. Please disseminate information about Promise 1 and Promise 2 and the Barnahus movement. Please become active partners, send us feedback, be with us, and support the partner countries and other countries who want to set up. So thank you very much. Thank you a lot.
If I can say one thing before we go, when the webinar closes, a window will open up in your browser that is a survey. We very much look forward to your reflections and input and what you thought about this webinar, so that when we prepare the webinars in the Promise 2 project, that we'll grow and be better than ever. So once again, thank you very much and have a lovely afternoon.